On December 13, 1799, this gentleman, after riding through the snowy weather, had developed a fever and a severe throat infection. Now that was huge back in the day. Fortunately for this gentleman, he was important enough to have 3 personal physicians to take care of him. Now what they did was what they knew at that time, which is to draw blood from his body by using leeches to cure him. He died the next day. Now this man was George Washington, America's first president. They bled him 4 times in a span of 8 hours, which accounts to almost 40% of his blood being drawn. Now to give context, if you donate 10% of your blood, that would take almost 4 to 8 weeks to replenish. Now let's start from where does this mania of using leeches and removal of blood actually started. It all started with this guy. Let me correct myself. It all started in ancient Egypt in 1500 BC, where they thought illness was caused by evil spirits and demonic forces, and they thought they should provide blood to appease the spirits, and they started removing blood from their body like a maniac with sharp instruments like this, which they later moved on to leeches. Then comes this gentleman, Hippocrates, who was a Greek philosopher and a physician, who was also known as father of medicine. So what he thought was our human body is made up of 4 fluids: blood, phlegm, yellow bile, and black bile. And these are responsible for not only our health, but also our personality. Like a healthy person is supposed to have this in balance. Too much yellow bile means you have too much cholesterol, meaning the person will be short-tempered and angry, and we all know how much anger boils our blood. If only we have thought of anger as some form of illness, then maybe we would have less angry people today. I don't know. So if you're an angry person, maybe thou hast too much yellow bile, and it shall be removed, and thou shalt be cured. Like if a patient has turned tomato red from fever, their conclusion is that the patient has too much blood and it should be removed from the body instantly. So what they used to do is slap a leech into their body and they will suck the blood out of them. Thou shalt be cured. They also believe that diseases like typhoid, plague and smallpox are nothing but stagnant blood, as if it's rotting away in one place, and all they need is like a little push from a little friend, leechy leech. What they noticed is when you keep blood in a container for several hours, it would form 4 layers, like a dark clot, a red layer, a white layer on top, and a thin yellow layer on the top. What can they do? They were only working with what they could see. But I have to point out that Hippocrates did not endorse the leech therapy. He was mostly advocated on diet and exercise. And then there was this physician who goes by the name Erasistratus, quite a difficult name. He was too smart for the human theory. He rejected all of it. No, he has one better. He believed that every diseases stem from too much blood in our body. I mean, this guy despised blood. Like anything happens, it must be blood's fault. This gentleman also thought air is transported through arteries, and we are eating too much food, which is creating so much blood that it is overflowing. It is spilling through our veins. Only good thing is he did not recommend use of leech therapy for removing blood. Instead, he recommended diet, which is supposed to starve the blood supply and to cure you. He was not this goofball. He has his achievements, which I will not cover in this video. Then comes this guy, Galen, from Roman Empire. He took the idea of humor imbalance and took it to the nth degree. Like he thought it was root of all diseases. He wrote extensively on the human theory and expanded on it for about 2 million words, and wrote all sorts of theories like how all humors are not equal and blood is the dominant of all of them. He was one of the most influential person in the Western medicine, and his works single-handedly dominated for almost 1500 years and were studied by other physicians all over the world. Basically, he popularized the use of leech therapy for all sorts of diseases. Slowly, this miracle discovery of curing all diseases spread all across India, China, and through Middle East. While all of this news spread, in around 1163, churches prohibited monks and priests from bloodletting, who often used to take the role of doctors. In result of that, the barbers came forward and said, why not? We have the instruments. So along with trims and shaves, they started offering all sorts of services like bloodletting, cupping, tooth extractions, lancing, and even amputations. These are the infamous barber surgeons of that age. Imagine going to the barber for getting a haircut and also getting your tooth extracted. On top of that, they used to hang their blood-ridden clothes in their barber poles. Like you walk into a barber room and suddenly you see blood-ridden clothes. And it was crazy times, but I'm guessing like people are desperate enough to go through all of this. Even in those days, people did not lack humor at all. Like in 15th century in Welsh manuscript, there was even this joke about bleeding through armpit. And I can only imagine 2 barbers like talking to each other and said, if you bleed here, patient will die from laughing. Like it was pretty funny, to be honest. Like even humor never changes, I guess. By 1830, leech therapy peaked at the height of popularity by this Parisian physician named Dr. Francois Joseph Victor Procès. Oh, what a difficult name. Another gentleman with another grandiose idea, like who believed that fevers occur through inflammation of the organs itself, and he believed in slapping few leeches on that specific organ when you have a disease. Like you can only imagine where all he was slapping the leeches in the body when someone came with an agonizing pain. Imagine you go to the doctor and you have a stomach pain and it's leech time, baby. Lie down. You gotta have some leeches on your stomach. Let them feed on the excess blood you have. Am I right? Due to his popularity, France was importing around 35 million leeches in 1 year, and among that, Paris was importing 5 to 6 million leeches alone, and more than 300,000 liters of blood were drawn by the leeches. In some cases, patients lost 80% of the blood in single leeching. Like leeching is the thing where they just add a bunch of leeches in a body and they just keep sucking up blood until they're done. Yeah. Now these are some well-fed leeches. They got fed more than cattle in a farmhouse. Soon leech farming started all over Europe, and it became a huge problem, like over-harvesting, and there was a huge demand for the leeches, and those demands were still not met. So by the end of 18th century, they started importing some wild leeches, and they also started doing some weird leech breeding practices. Like for instance, this one leech farmer who said that they had to serve 200 cow and dozens of donkeys to feed the 800,000 leeches, like it's some sort of messiah or something. Like, we must serve all the holy gods of leeches. They got better treatment than any other animal in the world at that time. Like at that period, you could even buy leeches from a local pharmacy. Like in St. Thomas Hospital, their use of leech rose from 1607 in 1815 to 50,000 in 1822, and spent 8% of their annual budget only on leeches, which is more than an average annual salary of a physician from that period. Now you might be wondering, how long does this madness continue? Like everything has to come to an end at some point, right? Because clearly it didn't turn out to be the miraculous cure they thought it was. So it all lasted until the French physician by the name Pierre Charles Alexander Louis, another foreign physician, who started poking holes in this theory in the miraculous cure of leeches to suck the blood out of the patients. So what he did is he published a paper in 1828 where he conducted one of the first clinical trial study by looking at the mortality rate of 77 pneumonia patients, where he found that patients who were bloodlet earlier, where he found that 44% of the patients who bloodlet earlier died compared to 25% of the patients who were bloodlet later. Yeah, bloodletting was not an option. Like you cannot not do that. Like that was the thing at that time. So he published the study, and this was a huge crack in the core ideology of using leech for everything, right? Then in 1850, when Louis Pasteur came up with the germ theory of diseases, which was the final blow to this, and it slowly started fading away by the late 19th century, until it made a comeback in the 1970s, which we'll go into it later. And before that, let's just take a deep breath. Okay, so what is it about this cute little creature, squishy creature, that made them so popular? There are around 700 species of leeches all around the blood, and not all of them are bloodsuckers. At least not of human. Two most important leeches are Hirudo medicinalis and Hirudo verbana. So what leech does is they have hundreds of teeth. Before that, they inject an anticoagulant in our blood called hirudin through their saliva that allow the juices to keep on flowing for them. So what happens is platelets in our blood, they act very quickly when there is an open wound, and the blood cells started clamping together to prevent the blood from leaking out wherever there is an open wound. On top of that, their saliva is also a local anesthetic so that you don't feel any pain. How convenient for both of us. You don't feel any pain, and leech can carry on drinking its own juice. Another cool fact about leeches are they're very effective at removing blood and drink up to 10 times their own body weight. Their stomach allows them to store lots of blood, and they can also survive several years without having any food, and several months, and sometimes for a month without food, by gathering nutrients from its body. Imagine if mosquitoes were like that, or maybe humanity might not thrive as it is today, right? I don't know about this. Well, surgeons have been using it for since 1970s. Surgeons have started using it again for reattaching fingers, ears, parts of the body, and whatnot. Like in 1983, Dr. Bryant had found a patient with an upper lip torn by dog bite and left it hanging by 1 or 2 blood vessels. He said it was impossible to attach without leech therapy because after attachment, the blood needs to flow right through the veins, through these tiny veins, and for that surgery to be successful. Like our body clots all the blood as soon as there is an open wound. So even after reattaching, the tissue might die. So for that, the blood needs to keep on flowing. So leeches allow blood to keep on flowing several hours even after they're done sucking on the blood. And in another case in 1985, the American plastic surgeon by the name John Upton, who attached a 5-year kid's ear, which was also bitten by another dog. And ears are also difficult to attach due to its tiny veins all across, and it was almost impossible without the leech therapy. And then he remembered about leeches, like where he has studied in several surgeries before. What he did is like he started using it. Not only it was successful, it was the second successful ear attachment up until that point. In Swansea is it in Wales. Today, iFirm company runs the world's only leech supply operation, which harvesting 60,000 leeches every year, which is much less compared to millions back in the day, but it still is in use today. Like, thanks to the one person who have watched till the end, unless you skip till the end, which is very bad behavior. Don't do that. Thanks for watching and subscribe.